Gagasi FM, the sound of KZN. You're wide awake on the Uprising with Kuli and Felix. And right now we have an expert in studio from Cloud Therapist, a friend of the Uprising who's also a psychologist. Also, nabisela kabanzi ngodaba mental health. Kumete sikubingele sikwamukele kwi Gagasi FM.
Njani namhlanje?
Siphilile mfoka baba kahle wena?
Sikhona.
100%. Yini Cloud Therapist?
Well, Cloud Therapist is a digital mental health platform.
Okay.
That is an ecosystem of psychologists, registered counselors, social workers, where we provide digital mental health online. Because what we saw was that there is a big discrepancy when it comes to the access to mental health care and the people that need support. So there is a small number of psychologists or mental health professionals and a big number of population that requires care. And then we said, no, if we provide mental health digitally online, that would then assist in terms of reaching that geographical constraint. You may be in Cape Town, you may be in Kenya, you may be in America, but you can be able to then go online and be able to request assistance and get support.
Language ayikho into inkinga nkulu nje ukuthi wahamba uthi uyafika lapho therapist umlu.
Yeah.
Ufuna uchaze manje isingisi ke manje uchaze ukuthi.
Na umuzwa futhi thena uthi thini? Ngono ngolimi lebele.
Sometimes I just feel
yeah.
You know, and then I just go God. Awukwazi ukuchaza kahle.
Just go God.
Usichazela kabanzi mfowethu ngomuntu ongazi notice lona sin le mental health uthi mayibeka ungayibeka uthi.
Yeah, so angiqale ngesidlalelo nje Felix esithi when it comes to biomedical science, there's been a great strides that science has actually assisted in terms of, curing disease, managing disease, in terms of morbidity and mortality, right? So morbidity would be a process where a person is living with disease. So when it comes to diseases such as your leukemia, heart disease, stroke, cancer, all those have been managed all around the years. So if you look back maybe 3 decades back, you would see from 1965 in actual fact, until now there's been a lot of management when it comes to diseases in terms of morbidity. People now are able to live longer lives with these diseases, but a little has been done when it comes to the issues of brain disorders, of mental health. We still see suicide as a leading cause, of mortality. Right, so you see a lot of people that are actually, killing themselves, and no one is really pausing like we did, with these physical illnesses, right? In the last 3 decades, in terms of managing them and coming up with solutions to manage them, but no one is actually pausing and saying, what is it that we can do to deal with issues of mental health disorders, right? And come up with a kind of a lasting solution, in terms of assisting what people are actually struggling with. So that has been the problem, and those are issues, those are mental health issues that individuals are struggling with.
Now, Gumede, we want to know, in your expert opinion, what are some of the key signs or indicators ukuthi umuntu is struggling with their mental health, and how can we actually best support them in these situations?
Ngihlezi ngizama ukuchaza ukuthi i-presentation yomuntu who is struggling with mental health, it can be categorized in 3, right? So there's emotional aspects of it, where a person is actually, struggling with persistent sadness. There's hopelessness, there's they are tearful, and there's extreme mood swings, and including uncharacteristic irritability and anger, and then issues of feelings of unworthless. They always complain ukuthi hayi mina ngathi nje ayikho into engiphilelayo, osbanibani besana besikoleni bona sebaphumelele benza ukuthi nokuthi, or behavioral, the social withdrawal, got engaged, pulling away from friends, family, social activities, and changes in sleep, sleeping too much, or alale kancane, struggling with insomnia, and changes in appetite, weight, significant weight loss or gain, and also neglecting responsibilities. And also then there's cognitive, right? Then they're struggling with concentration and remembering things, and they talk about also being a burden to other people and etc. and all of that. So all those then are dimensions that are actually kind of presenting as, onset mental health issues. And if ubona lezo zinto, those are onset difficulties that you can actually, nicely, in a nice way, you can come in and be able to, assist and behave and kind of have a conversation with that particular person.
And then let's look at some of the strategies, resources as well, that you would recommend for individuals looking to prioritize mental well-being, and also build resilience in the face of life's challenges.
Yes. Now, okubalekile is to seek help.
Okay.
That is very, very important. Seeking help may not mean necessarily jumping to, coming to see me as a psychologist, but you can confine to people that actually, you trust. Those people can be your close relatives, can be your family members, just to share, what you are going through and whatever issues that are struggling. And most of the mental health difficulty that a lot of people are presenting with, and also in our country that has a very compromised socio-economic conditions, where a lot of people are living in poverty, are living in unemployment, and there is that expose them to actually traumatic, especially abantu abasha. Think of a young girl who's from Makaya, coming all the way to Durban to come and study.
Culture shock.
Culture shock, environmental shock, but also they're from a very impoverished background. They're coming in a faster city where things are actually, moving very fast, and that requires money, right? And that actually then, present them into a total different environment, ending up taking, decisions that may compromise their integrity, their humanness or ubuntu babo no. And then those things that happens in that kind of environment, or compromising and doing things that actually that you would not do if you were in a better position, right? Then as you grow up later on, those things remain what we call trauma, right? They remain issues that actually, when you think back, you said, oh my God, that happened to me, and they remain kind of forever knocking in your cerebral cortex, in your mind, to say there are issues that actually happened to you that you did not deal with. They now present with what we call post-traumatic stress disorder. And you then start this kind of person presenting with these 3 key indicators of mental health issues that I was talking about. And then you wonder, because you see them, they are leading, maybe they are now a professional, they're leading a very, progressive and successful life, and you struggle with what is it that they're struggling with? These things that happened in the past, now presenting as a post-traumatic stress disorder. And those then are issues that then, a person needs to come forward and be able to deal with. And that's what people need to come to therapy for.
There was a mouthful, so much learning. There was a lot to take in at the same time. So for umuntu who's had an aha moment, sitting, maybe they're diagnosing their child who they thought it was just lazy and ungrateful and always wanting to, or maybe they are hermits, but trying to keep to their own company by locally Romaniabo and by a car, and they always in a state of helplessness and so forth. They want to interact with you more. Where can they follow you? Or where can they go?
So what we have since done, because what I was explaining later of the the need for mental health care, which we see now, and a lot of people are inquiring, a lot of people are coming actually, to seek mental health support. We've introduced technology, which I was talking about earlier on, which is the digital mental health platform, Cloud Therapist, where you can actually, go online and request to have a psychologist, and ultimately we are able to actually allocate you a therapist and ultimately have a session. So you can actually follow us through on all our socials on Cloud Therapist across platforms, Facebook, Instagram, and also call us on 031-944-0870. There you can get more information, and we are able then to actually book a session for you and ultimately be able to have a session wherever you may be in the world, because you don't need to come to see us in person, but through your phone you can have access to us.
Thank you so much. Sabelo Kume, the cloud therapist. Mental health issues on the Uprising with Felix and Kuli. You must try it out. It could change your life. Have one session with a therapist. It could change your life. It could save you. If it save a wretch like me, it could definitely save you. This is Gagasi FM. Stay tuned.